Hello everyone, I am Dr. Vinayaga Pandian. I am a senior consultant interventional cardiologist at Wokhad Hospitals at Bombay Central. Today we will be talking about wearable devices and its uses in the cardiac health. Today we are living in a highly technologically developed world, so fitness trackers, smartwatches, it is being the norm. So how useful these devices are and how it can be used for preventing or protecting our heart and keep our heart healthy. Smartwatches or fitness trackers, they are either magnetic chips or they are sensor based. So what they actually do is they go on a pulsatile oscillometry method and they check your heart rate as well as the oxygen level which is present in your blood. By this way, if any patient is having a history of heart failure, he is on medications, so he can pick up his heart failure symptoms early. His early heart failure symptoms will be visible on the smartwatch by a falling oxygen level in his blood. Also, many patients have sudden onset irregular heart rhythms. These irregular heart rhythms are known as arrhythmias. One of it which is most important is atrial fibrillation. Why atrial fibrillation? It is an irregular type of a heart rhythm which can cause you development of a stroke and it can cripple you for life. So many patients who have palpitation episodes but their ECGs are normal and other evaluation by the cardiologist is normal, sometimes this smartwatches picks up the heart rate and it gives you a real-time data that there has been an event when the irregular heart rate happened, thereby making a diagnosis and going for a further appropriate care. So the heart problems which these devices can detect early is, one is sudden drop in the heart rate which can happen with inferior wall myocardial infarction. If a patient is having chest pain and he has got a smartwatch and he is on a heart rate monitor and suddenly he notices that his heart rate is gone to 40 or 35, that means there is a massive heart attack ongoing. He needs to be rushed immediately to the hospital. Second, any patient who has got history of palpitations but not a conclusive diagnosis has been made, suddenly gets a palpitation, his smartwatch says his heart rate is flying at 130 or 140 beats per minute, that is making a diagnosis of an arrhythmia which needs to be tackled so that further complications do not occur. Also, there are many patients who are on medications for prevention or reduction in their episodes of heart failure. Those patients who have low pumping capacity or low ejection fraction of the heart chamber per se, those patients can also be picked up early when they start getting breathless. Before getting breathless, if they feel that when they are walking slightly, their smartwatch is showing an oxygen level slightly lesser, maybe in the 85, 90s, that means the patient is going to, next step is the patient is going to land up in a severe fulminant or decompensated heart failure. So we can come to the medical care at an early basis and prevent a hospitalization. These are the benefits of which will be given to you by the wearable devices. That depends on the technology which is making the devices. These wearable devices are made by multiple companies and they come at a different price ranges. Some devices can only monitor heart rate, some devices can check your oxygen levels, some devices can check the blood pressure also. There are some patches which are stuck on the chest and that also can monitor your heart level. So it depends on what type of technology is used. But yes, it definitely gives you a red flag. It helps you in that area when the patient is not visiting a doctor, not in his clinic, because certain events usually happen when the patient is doing his routine work. At that time, in that scenario, the smartwatch or the devices which the patient is using or any person is using, it can give us a red flag. It can definitely give a marker for further evaluation of the patient. So even though not 100% accurate, but yes, definitely we can say they are modestly accurate enough to help your doctor in treating and diagnosing and treating the underlying condition. Existing heart issues patients can definitely get benefited by wearable devices because some things which are to be monitored, like blood pressure or heart rate, drop in the blood pressure, drop in the heart rate, or rise in the heart rate. Definitely these are the things which these data can be utilized by the treating physician in the next visit or in the consultation to modify or optimize the medications, thereby improving the compliance as well as improving the quality of life of the patient. One is yes, and second is no. Yes in the way because smart watches or smart devices or the wearable devices, they check your parameters. Also they help you in giving you motivation for maintaining a active lifestyle, like the step counters or the calorie counters. Also there are multiple watches which will tell you open air swimming or pool swimming or running or walking, that counts the loss of calories, how much energy you have spent, all these things give you motivation for a healthy lifestyle. Then when you are having a healthy lifestyle, definitely you are preventing not only a heart disease, also a brain disease, and also any other diseases which are basically because of lifestyle related. And no in the way is that wearing a smartwatch is not going to prevent you a heart attack just because you are wearing it, because if you are utilizing it for maintaining a better lifestyle, definitely it does in a secondary way, but primarily it doesn't. It will not going to prevent you by wearing it. You are not going to get a heart attack. No, that is not. But yes, it definitely helps you in monitoring the parameters and going to the medical facility at the earliest when you are seeing an abnormality. Downsides, I could remember only two. One is if the patient is already on an intracardiac machine, like there are many patients who have pacemakers inside their heart, who have cardiac defibrillators inside their heart. These patients can have interference by the magnetic chip of the smartwatches or the wearable devices. They have to talk with the doctor when they are going to use a fitness tracker or they are going to use a smartwatch if they are already having a cardiac device inside. This definitely has an interference. Second is all the fitness trackers, all those wearable devices, these are machines, and they are very smart and intelligent machines. They are collecting the data. So your health data is available to the machine and thereby to the company also. So data privacy, you have to maintain that. So that has to be seen, because your health data should not be in the public domain. So this is the second thing. These are the only two disadvantages. Other than that, it is a very smart machine. So you have to consult your own doctor or cardiologist regarding what type of device or wearable device will be best for you. If you have ever had palpitations, atrial fibrillation history, then yes, there are many smartwatches which typically gives or picks up an ongoing atrial fibrillation in the patient. So this will definitely help. So your consultant or your physician is the best person who will tell you what type of device you need and what type of monitoring has to be there. Since wearables collect your heart data, your vital monitors data, also in the near future there are devices which are in the pipeline which will be collecting your body sugar levels, your blood sugar levels, also your blood cholesterol levels. So with the inculcation of AI software into this data, definitely a lot of things can be done, like monitoring your sugar levels. Diabetic patients can have better monitoring of sugar levels, thereby preventing long-term diabetic complications. Also cardiac patients have better monitoring of their oxygen and the blood pressure levels, thereby optimizing the medications by the physician. So number of medications or the pill burden can come down if the wearables are helping us in getting the real-time data. And definitely over a period of time there will be machines which will definitely give you or tell you. Nowadays we have some machines which can predict, not predict, but which can diagnose a heart attack, like peripheral small chip ECG machines are available, which is there. So similarly, in a period of time, your smartwatch or fitness tracker might definitely tell you that there is heart attack which is happening, or the patient is going into a complication. Wearable devices or smart devices or the technology devices, accepting the technology into the management of the patient over a long duration, over a long term, okay, is going to be it's futuristic. But now, from the point with the arrival of AI, we see that it is not impossible to achieve it. In the near future, we are going to have much better devices, and definitely at a certain acceptable pricing, which will be giving us more data.